Are you a cash-based clinic owner and you're wondering, what's one thing to know if I'm on the right track with any of my patients? Maybe you're stuck. Maybe you find yourself at 12 sessions in thinking, I should 100% getting this patient to be pain-free. I don't know what's taking so long. Or you're a magician and you can get them pain-free in one visit. You're trying to figure out, is that a good thing? Is that a bad thing? How do I know I'm on track with my patient outcomes as a cash-based clinic owner? If so, you're in the right place. My name is Garcia. I help cash-based clinic owners just like yourself thrive in business, improve their clinical outcomes, and just be successful in their private practice. The question I get asked often is, how do I know if I'm on the right track? What's the one indicator? What's an indicator besides goniometric measures or outcome measures? How do I know as a practice owner, what's the guide? What's the protocol? Everything that we've learned in PT school or CEU courses or even residency has been based on the insurance-based model, functional outcome measures. But ultimately in the cash-based setting, you have to understand this is about the patient's subjective report and how well they feel, not just from a functional standpoint, but do they buy into your services? Do they think that you're worth paying the amount, whatever it is that you charge for your services? And so after practicing for 10 years as a cash-based clinic owner, 15 years in pro sports and having us 15 staff and 3 locations, I've had my fair share of cash pay patients. And I can tell you there's a few things that you need to do to make sure that you're on the right track. And there's one particular measure that will help you understand if you are on track or if you're off track. And that measure is 90%. 90%, what I mean by that is patient subjective report, meaning if you're working with a patient and they're in pain and they might say, well, I have a 5 out of 10 low back pain and I can't run, or I can't deadlift, I can't squat, I can't, whatever the problem is. What you're trying to look for is a 90% improvement in their overall ADLs and return to sport, return to fitness, whatever it is. Do they feel before their treatment with you, if that was 100%, they had 0 pain before, how close are they to that pre-injury number? And we know that if you can get to 100%, that would be ideal. But for that to happen, that might take weeks to months. And as a private practice owner, you're trying to figure out, is this patient in the right place? And are they in the direction that they need to? So you can adjust your plan of care. And the target you need to hit is 90%. Next question is when? An easy number for you is most people will come into a practice for 2 times a week for 6 to 8 weeks. On average, you should be seeing that person twice a week and getting 90% by that 6th visit. And the reason for that is patients need to see an improvement in function. They need to see improvement in pain reduction. They don't care necessarily about goniometric measures. They don't care about outcome measures because that's not how they feel. They might report that, but ultimately what they're saying in those things is, yes, it's helped me, but that really hasn't helped me deadlift. That hasn't helped me squat. Those measures are for low-level return to daily activities based on the insurance-based model. So when you provide those measures, you're using that old model that you were taught in PT school or insurance-based care. Now you're taking it up a notch, and these people are trying to go back to soccer. They're more active. So those measures were great, and they were cute for the insurance-based model, but now as you take it up a notch and you want to be in cash-based care, or maybe you're a year in or 2 years in, and you're trying to fine tune that. So a good measure that you can have is, can you get somebody to 90% improvement in their ADLs and in their fitness or return to sport within those 6 sessions? Now, the average drop-off rate for most cash-based companies is right around that 3 to 4 visit mark. And the reason is because you haven't set those expectations, or you haven't been able to deliver on those expectations that you set for that patient. Now, if you can get to 90% within 6 visits, that means that that patient sees that positive trend. They actually are seeing progress. And then on average, if you did that math, it's about 15% improvement on every session. And what that patient sees is they have a steady increase in improvement. If you have a slower process and you're now only improving 5 to 10%, that person is now questioning, is this person doing anything different? Why would I not just go see my insurance-based care provider? They might like you and your personality, but ultimately you have to be able to create those results. And that's what people are looking for. So you have to be able to judge, am I on the right track? You should be getting about 15% improvement per session to get you to that 90% by that 6 session mark. If you're not, you need to make adjustments inside every session very quickly. And what I mean by that is, ask that client or ask that patient, How much better are you compared to when you first started? And they might be 25%. That's fantastic. I need to see you at 50% in the next 2 weeks. So here's what we're going to adjust. You're going to start changing the rehab program. You're going to start changing the parameters in the gym. You're going to start changing all of these factors so you can get there a little faster. It gives you a guide. Are you on the right track? It gives you kind of a North Star. If you're lost, you're looking up at the stars. And if you get really bombarded with more goniometric measures, with more forward flexion, more hamstring length, that doesn't help their functional improvement. And that's what they're looking for. Can you help me run? Can you help me deadlift? And that subjective report will give you probably that best indicator. I'm not telling you to stop any of the other measures. I'm trying to tell you to add this into your arsenal of ways that you're knowing that you're successful. So if you know their pain is being reduced, you have their functional measures, you have their goniometric measures, and now you know their subjective improvement, you can now put that all together inside your toolbox. As a cash-based clinic owner, you'll notice that you can't use that same model that insurance-based care taught you or PT school taught you. So this is one way to know if you're on that right track. Implement this in your daily practice with all of your patients, whether they're 8 years old, 15 years old, 80 years old. Everyone wants to know that they're improving, and sometimes patients don't self-reflect. So this gives them an opportunity to verbalize that. Most people avoid this. Why? Because they're afraid of knowing that they didn't get the patient better. And the reality is it's better to have that tough, hard conversation with that patient in front of you instead of the patient saying, well, let me check my schedule. I'm busy next month. My schedule changes. What they're saying is, you're no longer worth it. You didn't meet my expectations. And for that reason, I'm going to drop off. Rather than having the great conversation of, wow, you're only 10%, Mr. Jones. What we're going to do is we're going to adjust all of these things inside your plan of care so that you're at 35 to 50% in the next week or two. Now that person can see a road. Oh, I was concerned that I was moving slower than normal. We can ramp that up, and that's what I'm looking for. And that's what people want. That's why they go cash pay, because they want that opportunity to be able to have those conversations and be able to meet with a provider who understands them. And that is one way that you can know that you're on the right track as a cash PT clinic owner.